Let me also welcome Naina Lal Kidwai into the conversation. Naina, many thanks for joining us on this very special day. And I know you are someone who's been championing the cause of sanitation, of water, of hygiene for about 6 years now when you started the Sanitation Coalition, Naina. I want to understand from you the journey that's been covered, the distance that's been covered, and more importantly, the 5 things, since we're asking everyone to share with us the 5 things that we need to focus on and prioritize. What would those be?
So, Shireen, let me first start by thanking CNBC for making this such an important issue, for Rekit Benkaiser, Ravi, who is on our steering committee, the India Sanitation Coalition, and all that he brings, Amitabh, for the role he's played in ensuring that the competition that is created between cities is one that is absolutely paramount. So when you ask me about the 5 things, I think you have covered some, the criticality of the provision of toilets, absolutely, and what the government has done within that. The role of communities in ensuring that the whole understanding and linkage between health and sanitation happens. Very thrilled to see the Municipal Corporation of Indore and Punjab profiled by you. We need our municipal commissioners and the leadership they provide at the city level. I would like to add one conversation which those of us who work in the field are still working at, and we have a long ways to go, and that is the treatment side of it. It is not good enough to just now funnel all the shit into these toilets. If we do not treat it, and it goes right back into the fields we had funneled it away from, then it's going to be a national disaster. Yeah. So the cleaning, the sewage treatment, the ensuring that we have recovery of wastewater from that treatment is key. And in order to do this, the infrastructure needs to be provided. It needs to be provided at a very distributed level. Gone are the days where we need just large municipal corporation built plants. We can have smaller plants. They can go into RWAs, into buildings, which is indeed what is mandated. We as citizens have to demand that these are always in working order and that the treatment facilities are indeed working. And believe me, the recovery, whether it be fertilizer in terms of the solid waste that is left, or indeed the wastewater recovery, is going to make it worthwhile. And if we as citizens have to pay for this treatment, then so be it. We must be willing to, because it keeps our environment and our water bodies clean. But the role of the citizen in knowing, demanding, and ensuring that we get the right level of hygiene and cleanliness, whether we're in a city or a village, is very, very critical.
What is Naina ji, namaste. This is Anand Narasimhan here, and this is not just on CNBC. It's on Awaaz, on News 18 India, and on CNN News 18. So the entire might of the network is championing this campaign, because that's how important it is. But tell us a little more about the Lighthouse Village project. What is it all about in Uttar Pradesh?
I am so happy that you asked. The Lighthouse project is a partnership which the Department of Drinking Water and Sanitation, the ministry at the center, has created, and 75 districts and gram panchayats across the country have been selected, of which UP has a number, and these are in Barabanki, in Lucknow, in Haldoi, in Saharanpur. So across these, where corporates have been picked and selected to work in partnership with the grassroots functionaries. And what the government is saying is, look, we have dedicated and committed enough money. We need to make sure that this is well spent. And in fact, at the core of this is the collaboration that the private sector, the not-for-profit, and government, and of course the community can provide to make this model work. And the most successful models, whether in sanitation or water or any activity that is engaged in, are those where these collaborations come together. So what the Lighthouse Project has conceived of is, in UP, we have the HCL Foundation, Tata Trust, and ITC as 3 major corporates who've come in, working with the Aga Khan Foundation, who is a grassroots provider of these services, and of course the panchayats themselves and the mission directors working as a collaboration to ensure that government-committed money is spent, that it's spent in a way that is holistic in terms of provision of toilets. But if you look at our India Sanitation Coalition, which is making all of this come together, it is the build, yes, but the use, which comes with community activity, ensuring people use the toilets, maintain the toilets, and the treatment, the bump tea, is so important in this. And in ensuring that water is also provided, and that technology, repair, and innovation solutions are also provided at each level. And this partnership is well underway right now in Uttar Pradesh and, of course, in other parts of the country to ensure that we can create these model villages for others to follow.
Fantastic.
Absolutely. And, you know, it's wonderful to hear the birds chirping as Naina Lal Kidwai is speaking. It's absolutely wonderful to have that. But, Mr. Kant, I just want to pick up on what we heard there from Naina. And I remember the day that the Swachh Bharat mission was launched, you and Param Iyer joined me that night to speak about the execution roadmap. And the aspect of collaboration, not just government at the center, but local governments, state governments, local administrations, the private sector, the social sector, getting everyone involved to make this a shared responsibility. How apprehensive were you at the start of the mission that without this collaboration, it wouldn't happen? And has this exceeded your expectation, the kind of partnerships that have evolved?
Yeah. So let me first compliment Naina for being so passionate about an issue which is of such a major concern for the country. Secondly, you know, I really think that when we started this, we'd not anticipated that there will be such a huge community response. It's been possible largely because of a huge political drive from the top. But I think it's also been possible because we've been able to get the community involved. Thirdly, I think important thing is that we did a huge amount of competition. So one of the things we learned earlier on is that it's very important to get data. Data is important for governance. Put that data in public domain, start ranking districts, start ranking municipalities, start ranking states. This is exactly what we've done in aspirational districts. We picked up the most backward districts of India. The Prime Minister didn't call them the backward, he called them the aspirational district. We ranked them, we named and shamed poor performance, we appreciated good performance, and once you put out real-time data in public domain, it makes a huge difference. One last point I want to make, which Naina talked about, and that is about creating a business model. It's very, very important that if you want to sustain this over a long period of time, all of us Indians must learn to pay for water and must learn to pay for sanitation as well as we go along. Because each one of us must realize this, that sustaining such a large movement is possible if all of us really are able to help towards creating a great business model. You know, reuse of water, recycling of water, all this requires innovation, all this requires technology of a very good scale. And then we need to take it all across India, and at least the urban people, each one of us who come from middle or upper middle class family, each one of us must learn to pay for it.
Pay for it, yes, but also use it responsibly and also take the message forward. So we are hoping to reach at least 200 million people, and we're hoping that at least today through this telethon, and each of those 200 million people, if we can take it to another 5 people, imagine, we should be able to take this message to nearly 1 billion people, ladies and gentlemen. That's what we need to do, and get talking about it, not just talking, start acting on it too.